Hello, thank you for tuning in. Today we are going to talk about cervical cancer screening. So cancer globally has been on the rise, and I'm sure that most of us, if not all, we know a family member, a colleague, a loved one, or even ourselves who have been affected by cancer and they have either died from it or they have it at the moment and they're fighting for their lives. We know the damage that cancer can bring to a family, not just financially, but also, the emotion bit of it, the psychological trauma, the suffering and the grief that you go through when you have cancer or when you have someone who is going through cancer treatment or suffering from cancer. The problem with most cancers is that most of them, by the time you get symptoms or by the time they are detected, it's a tad late and there is a bit almost nothing that you can do about it other than just try to fight for your life. A few of them, and cervical cancer is one of them, have vaccinations or ways of detecting them early so that you can actually stand a chance of surviving from it 100%, right? And that is our focus for today. We are going to talk about cervical cancer screening and some bit of cervical cancer vaccination or HPV vaccination. So, cervical cancer, it is the second commonest cancer among women, second to breast, so quite common. It is caused by a virus called HPV. In full, it's human papillomavirus. Human papillomavirus comes in so many strains or types. There are actually over 100 types. Some of them are not so bad, what we call low risk, and these are the ones that are not associated with cancer. They can cause things like genital warts, which are just growths that can occur in your genital area or sometimes on your feet, on the sole of, or on the palms of your hands, or even your throat, okay? And then we have another category of HPV viruses called the high-risk type, which are the ones that now are associated with the cervical cancer or some other type of cancer such as penile cancer, vaginal cancer, vulvar cancer, among others. So how does someone get HPV? HPV is a sexually transmitted infection. So anyone who is sexually active stands a risk of getting it. It does not just mean vaginal sex, it means even oral sex, it means even anal sex. So for those of us who feel like, no, I have not had vaginal sex and therefore I'm safe, you are not really safe. As long as you have had any form of sex, it's actually possible that you have gotten HPV virus. The problem is that HPV is very, very common in the community. Actually, over 80% of the people have HPV virus, right? And that means that for as long as you're sexually active, there is a very, very high chance that you will get HPV at some point in your life. And therefore, there is a chance that you might end up getting cervical cancer, okay? The good news is that most of the HPV virus is cleared by your own body, especially the ones that you get when you're still young, maybe between 15 to 25 years. Most of it, your body sort of clears it and you recover from it, maybe sometimes even fully. But there are those ones which may persist and they cause some changes on your cervix, or sometimes even it ends up causing cancer of the cervix, okay? One of the things that we can do is to take a vaccination against HPV, and this is one of the ways of prevention of cervical cancer. So there is a government, drive to vaccinate young girls and boys against HPV virus, and I would really recommend it strongly that if you have a child, not just a girl or even a boy, and they fit the category of going for the vaccination, that is between 9 to 12 years, please take them. When the schools trying to offer this service, because we have healthcare workers who come to schools to administer these vaccinations, please embrace it, give the consent, and let your child's life be saved. If you know a niece, a nephew who may benefit from this, or even yourself, because this vaccine may be helpful even for people up to the age of 25 or even older than that, even 45. It can offer you some bit of protection one way or another. Go for it. There's a lot of myths, a lot of misunderstandings around the HPV vaccine. People have associated with a lot of lies, which for sure I'll tell you today it's lies, because I know for a fact that